So, Bismillah Rahman Rahim, in continuation of our topic of oral care products. This is our third lecture in oral care products. So, what we have to do before that, we have learned about how to formulate toothpaste. Now, in this chapter, we learn about mouthwash as teeth whitening preparations. So, mouthwash are mostly uh, it's uh, it's a mouthwash, or the other name is also mouth rinse. So it is antiseptic and anti-plaque. Mouth rinse claims to kill germs that cause plaque, gingivitis, and bad breath. So it has three functions. First, they stop the plaque, they, they improve the gingivitis, and they also remove the bad breath. So another one, it is anti-cavity mouth rinse uses fluoride to protect against tooth decay. Third, the use of mouthwash does not eliminate the need for both brushing and flossing. So, beside that, when you have to rinse the mouth with mouthwash, you also need the brushing and flossing the teeth, whatever age is. In younger age, there is no need of flossing, but in older age, then the tooth have developed, then they need flossing also. Now, ingredients of mouthwash, it's a large overlap in ingredients used in toothpaste. First one is solvents. So in the water, mostly they use deionized or distilled to avoid interaction with other components. So must use DI water or distilled water for solvents. Another one is ethanol, used as solvent, good solubilizer and freshness effects can give by ethanol. Second, they have to use flavor. So main function for a mouthwash is to leave a nice, fresh feeling. That's why flavor has to be added. Third is phenolics. What they do, the phenolics, they kill germs that cause bad breath and plaque. For this, they use thymol, eucalyptol, and menthol. They also added humectants. So what they do, aid in solubilization of flavor, add sweetness, and increase osmotic pressure, hence decreases the risk of microbial growth. Fifth thing, solubilizers are emulsifier. What they do? They help maintain clear and end product. Polyoximers, polysorbates. Six, antimicrobials. They have cetyl pyridinium chloride, chlorhexidinium, chlorhexidine, its main function for a mouthwash is to leave a nice, fresh feeling. Then they add buffers. What they do, they maintain suitable pH. For this, they add benzoic acid, sodium benzoate, and sodium phosphate. Now, their teeth whitenings. What happens is food, cigarette smoke, coffee, etc., from another layer gradually on top of the enamel layer. So the person sometimes food layers or cigarette smoking or coffee they used to take. So they can make a layer over the enamel of the tooth. You say then basically foreign material accumulates to form a pellicle film over the enamel layers. So whitening products, one at dentist clinic, second OTC products. So you can see in both before use of teeth whitening and after that. Now the problem is as this pellicle layer sits on teeth for years and years, the foreign material gets into the enamel. So the enamel layer is made up of hydroxy crystals which forms microscopic hexagonal rods. So its enamel is porous. Staining agents can work their way down into the tooth where removing them away is hard. The deeper stains are basically harmless, but many people find them unattractive. So you can see this face over there is a pellicle layer over this. So over that one tooth. So it has to be removed to make it a shining and white tooth. The most tooth whiteners use one of two chemicals. What they use? First, they use hydrogen peroxide or carbamide peroxide. So two chemicals are used for tooth whitening, hydrogen peroxide and carbamides. When you use in mouth, carbamide peroxide breaks down into hydrogen peroxide and urea, with hydrogen peroxide being the active whitening ingredient. So hydrogen peroxide is used as a active whitening ingredients. So dentist supervised tooth whitening involves the controlled use of carbamide or hydrogen peroxides. The procedure involves the dentist gently cleaning teeth and then putting a protective barrier on the gums. The dentist then places hydrogen peroxide paste on the teeth for several minutes, rinse it off, and usually reapplies it several times. So there was two method. One, you go to a dentist and dentist has to clean and make your tooth white with the procedure. Other, you have to use this teeth whitening paste, whatever it is required. So what the dentist do? The dentist place hydrogen peroxide paste on the teeth for several minutes, rinse it off, and usually reapplies it several times. Then over-the-counter toothpaste, mostly when you have to go and purchase these from the market. So whitening also involves the use of carbamide, peroxide or hydrogen peroxide. So when you go in the market, in the store, you have to purchase whitening agent. They also have carbamide and hydrogen peroxide. Most are relatively easy to use, and independent research has shown that they are effective. Is tooth white safe? Most studies confirm that tooth whitening is safe and effective. Whitening gel that contains 10% carbamide peroxide equivalent to 3.6% hydrogen peroxide have not been shown to cause any damage to the enamel of the tooth. Higher concentration of carbamide and hydrogen peroxide available from the dentist may weaken the enamel, but most of these formulas also contain fluoride, offsetting this potential side effect. To sensitivity or gum irritation occurs, starts using the whitening products less frequently, say every other day instead of every day, and reduce the amount of time spent whitening. So don't go frequently, you have to use. Whenever you require, you have to take tooth whitenings. So all hygiene products, in continuation of this, we can, different products are also available. Toothpaste we have done, brush with soft toothbrush for 2 minutes, no rinsing, eating or drinking for 20 minutes. Oral rinse 2 times a day with the cap full. Rinse for 1 minute and spit. If used in conjunction with the toothpaste, use the rinse first, then brush. So first, before going to toothpaste, rinse first, then brush over there. Then mouth spray. Mouth spray directly into mouth whenever relief is needed. There's still now the mouth sprays are also available. So then dry mouth gums can help to stimulate saliva flow for relief of dry mouth. Chewing regularly can help freshness, breath, and leave your mouth feeling clean and fresh. APPLETON dental hygiene products. It's a mouthwash. So what it has? It has sodas, sweets, cake. These tempting treats are hard for adults to avoid, but they can be even harder on your teeth. As a matter of fact, 2 out of 3 adults risk losing at least one permanent tooth due to decay. But with the power of fluoride, ACT, restoring anti-cavity mouthwash not only kills bad breath germs, it also strengthens enamel and restores essential mineral to weak spots. Listerine. The new product is alcohol-free for a less intense taste, but still contains the classic Listerine 4 essential oils. It has menthols, thymol, methyl salicylate, and eucalyptol. Listerine Zero kills up to 29% of plaque bacteria in vitro, more than other alcohol-free daily use mouthwashes. Listerine Zero also contains 220 ppm fluoride for effective enamel protection. Essentia water, drinking and swishing your mouth can have some dental benefits too. Water has a cleansing effect inside the mouth. It washes away debris just like saliva. But because a lot of germs in the mouth and the foods we eat are acidic, this essential water is great to counteract the acid and increases the pH inside the mouth. This product can be found at Whole Foods, producing high alkaline antioxidant. It structures super hydrating water, not complicated at all. Just pour yourself a glass of alkaline water. It is a simple and convenient method to purify and add alkalinity to the water. Now, THERMOFIT OCCLUSAL guard. You can have fluoride varnishes and gels to make dental clean. Now, fluoride varnishes. Now, fluoride varnishes is a highly concentrated form of fluoride which is applied to the tooth surface by dentists, dental hygienists, or other healthcare professionals. As a type of topical fluoride therapy, it is not a permanent varnish, but due to its adherence nature, it is able to stay in contact with the tooth surface for several hours. It may be applied to the enamel, dentine, or cementum of the tooth and can be used to help prevent decay. Demineralize the tooth surface and to treat dentist hypersensitivity. There are more than 30 fluoride containing varnish products on the market today and they have varying compositions and delivery systems. So you have to put varnishes. It has to be applied with the help of a dentist. Fluoride gels. Now, fluoride gel is a prescribed high concentrated topical agent intended either for professional application in plastic disposable tray 2 to 4 times per year or self-applied with aid of toothbrush once or twice per week. The formulations are based on sodium fluoride, acidulated phosphate fluoride or amine fluoride. The gels are flavored but contains no abrasive cleaning agents for preservatives. Effectiveness of the fluor gel. Effectiveness of the fluoride gel. There is good evidence from systematic reviews that fluoride gels can reduce caries increment of 20 to 8% in children and adolescents. There is little and conflicting reports on the use of self-applied fluor gels in primary dentition, and there is insufficient evidence to address whether or not there is difference in the efficacy of sodium fluoride and APF gels. You can say this is a Colgate fluoride gel, tooth bleaching agents to clean the tooth to make it white. Now, carbamide peroxide, it is the tooth whitener. Carbamide peroxide, a mild antiseptic, also called urea hydrogen peroxide, perhydrate, hypirol, or perhydrol, is an addition complex of hydrogen peroxide with urea, which has a mild effect. On contact with saliva, carbamide peroxide dissociate to hydrogen peroxide and urea. Harwood and Heman introduces bleaching of teeth with 10% carbamide peroxide gels placed in custom-built trays to be worn by patients at night for 2 to 6 weeks. Now, floss threads. You have to how to do floss in your teeth. Now, floss threaders. Instructions use approximately 16 inch of dental floss. Pull 4 to 5 pull 4 to 5 inches of floss through the loop of the thread. Pass floss threaders through space between teeth or under appliances. Remove floss from floss threader and begin normal flossing. Use with your preferred dental floss. The gum soft picks, teeth cleaners gently massage and stimulate the gums for long-term health. The gum spot pick can also be used to remove food particles stuck between your teeth. The picks reach spaces between teeth, bridges, crowns, implants, and braces. The pick promotes uniform blood circulation, which keeps your gums healthy. The soft dental floss is a good way to prevent against gingivitis as it helps remove plaque that cause the pockets to form along the gum line. So you have to use floss threads, different floss threads. Now you can see here fixed with the toothpick. Some there's floss threads are also available. By the help of that, you have to floss your teeth so it's cleaning over there to make a hygiene control. Now water flosser. The water pick ultra water flosser is clinically proven to be double as effective as string floss at improving gum teeth. So removes 99.9% of plaque from treated areas and triple as effective as string floss for cleaning around brushes. Convenient, handheld design with two tips, lightweight and is cordless and easy to use. Now clinically proven to reduce plaque, reverse gin, Gavesend. We have to again check over this on gums. The must go use gentle cleansing significantly reduces coffee, tea, and tobacco stains for naturally whiter teeth in just 28 days. जी बच्चों, जी मोहब्बत खान समझ आया कुछ? जी विशाल बेटा.
Yes, sir.
क्या क्या करने हैं आपको? दांत चमकाने के लिए क्या क्या चाहिए फिर आपको? बेसिक इंग्रेडिएंट क्या है टीथ व्हाइटनिंग के लिए? जी जुबैर.
जी सर.
हाँ, बेसिक इंग्रेडिएंट क्या है टीथ व्हाइटनिंग के लिए? जी तुबा शकील. मुझे बताएं कि बेसिक इंग्रेडिएंट क्या है टूथ व्हाइटनिंग के लिए जो इसमें हमने पढ़ा है, सुना है. जी मानूर साहब. मुआज अहमद आपको नहीं मालूम?
जी सर.
हाँ, कौन सा इसमें इंग्रेडिएंट है जिससे टूथ व्हाइटनिंग के लिए इस्तेमाल होता है?
सर बायोटीन. बायोटीन
नहीं,